The broadcast is now starting. All attendees are in listen-only mode.
Hi everyone. First of all, I'd like to thank you all for joining us on this webinar today, particularly given the storm that's outside. I hope everyone is safe and sound. We hope you all find it beneficial and that you can take some practical information. Today we're going to be covering the cycle of care, but I'm just going to start off by giving a quick introduction of who's actually on this webinar for you today. My name's Donal O'Neill. I'm the marketing manager for Clonwilliam Health, and I'll be emceeing today. With me, I have Louise Murray, our Socrates support team lead, who will be leading the training of today. So as you know, this is a series of webinars. We're going to be running them today and then for the next 3 weeks. So we hope you all can join us for the rest of them. We hope they're beneficial. Our goal is to provide you with sort of short, sharp demonstrations of different areas of the functionality of your Socrates system. And the goal is that you kind of move with a couple of practical takeaways that you can implement in your day-to-day work. So as I said, today we're running through cycle of care. We will be, this is the introduction. We'll be just doing a demonstration, and then at the end we'll take as many questions and give as many answers as we can. So I would say to you, in the on the right hand side of your screen, you should see some functionality that says questions there, and that will let you submit a question to us. Again, we'll get through as many as we can at the end of Louise's demonstration. So without further ado, I'm going to pass you over to Louise now to run through the demonstration. So Louise, you should be able to become the presenter now.
Okay.
There we go.
Okay. Hi, everybody. Hope everyone's okay. All right. Start off here. So the first thing so we're talking about diabetic cycle of care, or asthma and diabetic and periodic assessment cycle of care today. I'll show you mainly just the diabetic cycle of care. So the things that you need to have on your computer for this to work, to be able to submit them to the PCRS, is, first of all, you need to have a PCRS cert. That is to check the eligibility of the I'll just keep talking about diabetic patients, but it'll apply to asthma and periodic as well. So with the diabetic patients, the PCRS cert will make sure that the patient is eligible and has been registered through Socrates, or when you're in Socrates. Then you have your HealthLink certificate as well that's needed, because when you submit to the cycle of care, it's actually going to HealthLink, and they're organising that side of things. So when you have your PCRS certificate installed, the first thing is you need to have it installed. You need to know your username and password. So a lot of surgeries have their own username and passwords for if they've got multiple doctors, GMS doctors. One other thing to think about with the PCRS is you might have access to log on, but the doctors, it's a side note, on the website you need to make sure that the doctors can share their panels per se. So it's almost like if you're logged, the Dr. X can also see Dr. Y, because you need to be able to share to be able to submit them if you're a nurse or something like that. You don't want to be only able to submit for one doctor. You need to be able to submit for the other. So you need to make sure that they're shared. And then with the HealthLink certificate, you need to make sure that you have your username, password, and PIN. If you're logged on as a doctor doing the cycle of care, you've probably sent off e-referrals, so it'll remember your logons for that. If not, HealthLink can give you your username and password and PIN for that. That's the main thing for initially getting it started off. And then to actually do a cycle of care. So what some people have been doing over the last couple of years is we sent out an investigation called diabetic cycle of care. So what was happening was people were adding that into the chart, filling in the information, and then nothing was really being done with it because you couldn't send it off to the HSE. So as of the beginning of this year, March, April time, you've been able to submit them, depending on if you had to have the correct version, and most people should have the correct version and be able to send off cycle of care. So there's two things. One, you need to be able to send off your old ones if you want. You don't need to send off all your older ones. You might decide that you only want to send off from now on. So I'll show you, one, how to import your old ones if you want to send them off, and then two, just start one from scratch. So I'll start it off here. So I'll go into, I have some test patients set up. Let me see here. Okay, so diabetic 2. So this person is a diabetic patient. I filled in they're a diabetic patient and they have an investigation in their chart from December last year for a cycle of care. So I'm going to begin a consultation and go down to cycle of care, or care protocol, and then go into cycle of care. So if you have previous investigations in the chart, like this one here, you have the option of importing. You see this import button is there. If you don't have any, then it you can't, there's no import button. Also, if surgery set up their own custom investigation and didn't use our one, you can't import those because everything's tweaked a little bit, so it's only programmed to work with our one. So if I click on import, I've got the option of diabetic visits. At this very moment in time, what it's doing is it's checking to see if the PCRS number is eligible, the number if they've been registered as a diabetic patient. So it's actually checked there. I kind of done it quickly there, so I'll actually just do that again. Import diabetic visit, and you can see here in red there, it was checking the PCRS. And it's found that this person was registered on the 2nd of the 12th, 2017. If it comes up that there's no date in there, it'll tell you down here that that person isn't registered as a diabetic patient. Do you want to do it? And then all you have to do is, if you want to then, if they're not registered, you click here, and it opens up the PCRS website. You select your certificate, and then you log in with your PCRS username and password, and you register them on the PCRS site. So in this scenario, we don't need to do that because they've already been registered. So I'm just going to click on OK here, and it's just saying what you want to import. If you have an annual visit and then a follow-up visit, then that will appear in there, and they both will import. You don't have to highlight any of them; they'll just import. They'll all import. So from here, it's imported the investigation that I had created before. So just if people don't quite know what I'm doing there, it's this investigation in here. It's this investigation that you would have been filling in for the last few years for different patients. So from here, you have it's brought in the stuff that was filled in. So it's brought in stuff here, and there's this exclamation mark here to say that this field is required for submission. It won't let me send it off if I don't have a result filled in. So with the button with the 3 dots to the here, you can search for the blood results that have come down. Now in this scenario, it is since December, since the cycle of care was done, so it's defaulting to the last 6 months. So if I go back and look 12 months and go search, then it will return the blood result. So the main kind of question that gets asked a lot is, well, mine aren't, when I search for them, it's not coming up with creatine. So there's so many different labs around Ireland, and all labs call them all different. They've got different names, they change them the whole time. And so it's automatically looking for the word creatine, but it might be called something else wherever you're located in Ireland in your lab. So obviously, if it was an option for us that we could fill in every single one of them so that you can search for them and they'll come up automatically, we would, but it's constantly changing. So until it's decided that in all labs that it's all the same across all labs, it's just not possible for us to do that because there's too many different variables. So yeah, that's that. And then in here, you've got so you can just manually, in this scenario, I'm just going to manually fill in a result because this is just a test patient. There's no actual blood results in it. And you can see over here on the left-hand side, it says incomplete because it was incomplete. And if I click on the save button down here at the bottom right, it's now changed to yellow. So it's completed. I have all the mandatory fields and all the stuff filled in. So I can then click on the submit button. And when I submit it, it sends it off. Now, in my scenario, it knows what my HealthLink username, password, and PIN is. so it is automatically setting it off. If you're doing this for the first time, it'll ask you for your username, password, and PIN, and all you have to do is fill that in, remember it, and you don't have to do it again. It'll just remember it. Yeah, so now it has changed to blue, so it knows that it's a waiting acknowledgement. So it's gone to the to True Health link. It's been sent off, and from there, when you download your blood results, you will get a response back. So I have the different colors down here. So when I look at this, so red is incomplete, yellow means it's unsent, but it's ready to be sent. The blue is the wait and acknowledgement one, so that's the one that we're seeing right now in that patient's chart. And then the green is the accepted. So when you download your bloods, it will say accepted. It'll turn red again if it says rejected, but also it tells you what each of it means when you in the chart as well. If it's rejected, you can always go back in and you can refill it in and see if there's something wrong with it. You know what it is, then you can save it and submit it. Now, all the kind of mandatory fields are kind of pre-filled in, so it's not very likely that you're going to have many rejected ones. Yeah, so that's that one. So that one is waiting acknowledgement. So I'm just going to X out of this chart here. A second now. And I'm going to go into a different patient, and I'm going to show you how to do one from scratch. So when I go new consultation, I will choose diabetic patient number 3. So in this patient's chart, all my patients haven't got much in, it's very basic, but all I know is they're diabetic. So over here, they're diabetic, and I've also filled in a baseline detail back in September for them. So that's filled in. So I need to begin a consultation and save. So if someone is coming in today, then you're obviously just going to be adding the cycle of care, and you're going to have to wait for a week or so for all the results to come back. So when I go in cycle of care and I click on add visit, from here it's just asking me what am I doing, and it's saying that this is a diabetic visit and it's an annual visit, and I click register, and there it's checking to see if that person has been registered for the PCRS, and this person registered for the diabetic cycle of care on the PCRS, and they have. So they were registered back on the 14th of the 9th, 2015. And we say okay to that. So there's one other thing that's cropping up a lot is if I highlight this diabetic here, this is just kind of a summary of what's been done for the cycle of care. It tells me the information here. PCRS registration date is the 14th of the 9th, 2015. So they were registered on that date with the PCRS for the diabetic cycle of care. So their diabetic year is from the 14th of the 9th of a year to the following 13th of the 9th of that year. So for example, this diabetic year started on the 14th of the 9th, 2018, and it will end on the 13th of the 9th, 2019. So you need to get your annual visit in that diabetic year. So it's not when they've come into you for the first time, it's when they've been registered on the PCRS as a diabetic patient. So people, if someone comes in, if this person didn't come in until August next year for their annual visit, their diabetic year, they have August, September, and their new diabetic year starting in September of next year. So you have to get your annual visit and your follow-up visit within that time frame. So every patient is different. So if I just quickly go back to diabetic patient 2, cycle of care, and highlight this person, you can see his yeah, I think it's a male. His diabetic year is from the 2nd of the 12th of a particular year until the following 1st of the 12th of the following year. So that's something that you need to keep an eye on as well. Okay, so this one is incomplete. So if I click on this one here, I can fill it in. So let's pretend that this is a week later and you're actually filling in all your results. So it's also brought in the patient's baseline details automatically, and it's got in the smoking and alcohol status because it's brought that in from the baseline. So if I click on the button here and I search for HbA1c, some of them will automatically fill in, some of them won't automatically fill in, because once again, as I was saying, the labs are different. There's like, I don't know, 20, 30, 40 different variables on each of these blood results because there's so many different labs calling them by different names. So I'm just going to manually fill these in because I don't actually have any blood results in the chart. But if I did, I can go search and search for it. Some people might have it down as cholesterol, search for it, etc. Then it will, you might be able to find it that way, or someone might be down as a different name, search, you'll double click on it and select it and it will bring it into this section here. So I'm going to fill in this person's information with some random stuff. So once again, the mandatory fields are the exclamation mark. So once again, searching, if it doesn't come up, then you fill it in. So it's brought in the baselines already. And if you had filled in the BP in under the baseline, it should come in as well. So I'll just fill in this here. Exercise, yes. Brief intervention, yes. Immunization offered, yes. Patient education discussed. Cycle care continuing, yes. And yes. And then you click on save. So at the moment it's in red over here. And when I click on save, it'll say unsent and it'll change to yellow. And then I can submit it and it will go. There's one thing I actually forgot to point out is it comes up when you're checking for when you're adding the visit for the first time, it will ask you for your PCRS login. I've accidentally remembered mine earlier, so it just automatically came up. So you just take note of what your PCRS username and password is when you're doing that. So the next thing I'll show you is the claim tracker. So I'm not actually going to submit this one because I just want to show you what happens to it when you say it's unsent. So when someone comes in for their cycle of care visit and you need to come in and you need to finish it, they won't be finishing it for a week or so. You don't have to remember each of the patients. You can see all of them in under the claim tracker. So when I go into my control panel and go to claim tracking, over here on the left-hand side, I've got my cycle of care. So as you can see, we have an asthma annual assessment. We got a diabetic annual visit. So that's the one that I filled in there. It's unsent. And we also have this one here. And if I click on unsent, I can see the incomplete ones. So these ones aren't finished. Awaiting acknowledgement ones. So those are the ones that we've submitted off and we're waiting for the HSE to send us back a response. And then accepted are the ones that will be accepted when you download your bloods. It will tell you accepted, rejected, and archived. So if you have some really old, you know, when you're importing your cycle of care visits and from years ago, and you decide, oh, sure, I don't want to send off all those old ones, there's no point. You can, I'll just do it under incomplete. I might decide, oh, sure, this one here, I don't really want to send off that cycle of care or annual assessment or any of the cycle of care visits. You can highlight it and archive it, and it will go into the archive section. So you don't really want to leave them in here, but you want a record of them in the chart, then you can archive them. You can highlight a good few of them and go archive, and they'll go into archive. Yeah, so from here, as I was saying, you don't need to remember everyone's names or that you saw last week for their cycle of care visits and you want to check the blood results. You can go into incomplete and you can say, all right, I actually want to look at this cycle of care visit, and you can begin your consultation, and you can go into the care protocol and you can fill in your cycle of care. So you don't need to close out of it all, basically. Or you don't have to remember, basically. So let's close all these windows. The next thing I'll show you is how to, if you want to know who's due their cycle of care visits, or their asthma cycle of care visits. So there's two things that you'll need to do. So for a while, a lot of people will have to run a few different reports. In the future, you'll just have one section of reports that you need to run. But since your annual and your follow-up visit information is filled into that investigation, you're going to have to go to the report section and run a report based on that investigation. So under investigations, you have your, down near the bottom, you have your investigation recall. And from here, you need to fill in select your diabetic cycle of care. And you choose what I want to report on is all the people that have an annual visit. I want to know, all right, who's coming in for their annual visit in the next month. And then you run that and it will return the answer. And then you run the other one again for follow-up visit. And then the same thing applies. You want to know who's coming in. So you say okay to that, and then you'll get a list of those. So for the next, until whenever you actually have started your diabetic cycle of care, from that date on a year, you're going to have to continue using this investigation. So if you're only starting today and you've been using the diabetic cycle of care investigation, some surgeries haven't been using their diabetic cycle of care investigation. They've actually just been filling in the information, but just not in that section. So in that scenario, you're just going to be starting from today, the cycle of care, and you're going to just start from scratch. So that should be perfectly fine. You won't need to use this report then. But for people that are, you're going to have to use this investigation report. And then from after that, you're going to be, in collaboration with that one, you're also going to be using the cycle of care reports. So from here, you've got your periodic assessments due, your assessments, asthma assessments due, and your diabetic assessments due as well. So you'll just run those reports instead, or as well. And then after a year or so, you won't have to use the other one, and you're just going to be using those. That's pretty much it, really.
That was great, Louise. That was really a comprehensive overview. I think you kind of captured it all quite well. We've had a couple of questions come in. I'm just kind of conscious of time as well, so everyone is getting ready for their lunch and whatnot. So we'll get through these questions as quickly as we can. First of all, is the asthma cycle of care the same process that you demoed? I know you did the diabetic one there, but is the asthma cycle pretty much the same steps throughout, or is there any differences that people would need to watch out for?
Yeah, it is the same. It's just that it's a lot smaller. What I might actually do is, I'll actually show that one. So the asthma and so the other two cycle of care visits, as you probably know, is the periodic assessment and the asthma assessment. So the asthma and the periodic are very similar. I'm actually just do the periodic one because it's the same kind of question. Yeah, I got a periodic example here. So if I go in here and I begin a consultation on that and save, I go down to care protocol and cycle of care. So if you can get past the diabetic cycle of care, the asthma and the periodic will be a breeze. Okay. So you click on add visit again as normal, and you choose what exactly that you're doing. So if it's a periodic assessment, you choose periodic. If it's asthma, you choose asthma. So periodic assessment, it'll default to 2 for this person because this person is 2 years old. And I go register. And once again, at that moment, it's checking the PCRS website. So as I was saying earlier as well, I was saying that it will come up with your PCRS logon for the first time. Mine, I accidentally, as I was saying earlier, I remembered I was meant to show you that window come up, but I accidentally clicked remember. So from here, you'll see your PCRS username and password. So everyone would know them. So this person was registered back in 2015. Doesn't quite make sense with this age, but anyway, it still works. I click on OK, and you just fill in the details. So you choose weight, 13 kg, 87 centimeters. No. No, so you just fill it in the same way like that. This is a lot easier than the last one. And I just click save. And at that moment, then you can also submit them. So they go into the claim tracking section earlier, as you would have seen. So they go in there as well if you don't want to send it just there. But when someone comes in for this type of cycle of care, they come in and out and you submit them on the same day. So submit, and then that goes off.
Great.
Yeah.
And then just had another one in terms of the report that you showed there. Does that include all patients who have been coded with the cycle of care in it? If you know what I mean. So with it, as long as you've assigned, it'll pull them. If you know what I mean.
I think I know what you mean. So if they are, they don't need to be coded. Whenever this is when you actually have a cycle of care visit in the chart. So if you don't have a diabetic cycle of care visit in the chart, you can't run against this report because there is none in the chart for it to run against.
I get you.
So yeah.
Okay.
You can also register. You can register a diabetic patient on the PCRS without having it in Socrates as being a diabetic patient. But obviously, surgeons are going to want to make sure that they have their diabetic patients coded as active diabetics.
No, that's perfect. That answers the question. And then just time for one more very, very quickly. If I have more than one PCRS cert on a machine, how do you get Socrates to use the correct cert?
Yeah, so most of the time the PCRS cert will just have one, but if you've got some old ones in there, so up here you've got edit and preferences, and then from there you've got, I lost my answer, communication. And from here, it's linking to your, like say on my machine, I actually have two certs. I have an old one, well, it's expiring in a few days, and I have this new one. So I select the new one in there.
Okay.
There's a new version of Socrates coming out in the next few weeks. So as you can see up here on my one, I actually have 2.6. So if anyone has 2.5, it'll actually, you probably won't see the certs very well, but over the next few weeks / 2 months, most surgeries will have the newer version in that. So yeah, you select it in there and you just say okay.
Great.
And that should be it.
Great. Look, that was brilliant, Louise. What I would say to everyone listening is if you have any follow-up questions or if anything occurs to you over the next little while, feel free to drop us an email and we'll be happy to help out and answer them. This webinar has been recorded, so we will be making it available on YouTube for you to refer back to, and you should get an email on Monday with a link to that. But if not, again, just drop me an email and I'll be happy to send you on the link. Thanks again, everyone, for attending. We look forward to seeing you all next week again, and enjoy the weekend. And thanks a lot, Louise.
Okay, good luck, everyone.
Cheers.
Bye.
Thank you. Bye-bye.